everyone. Hope you had a nice break. Before we get started, I think there might be some folks interested to know that the Bill Nye tie and the Hope tie are now up to $900, so we're going in the right direction. Feel free to send your bids to me at joel@ataxia.org. We're actually going to present that. We're going to actually finish up our auction on that tonight at the banquet, and we'll be doing our gift card giveaway for those who have submitted their passports from the exhibit hall game that we were playing. So we'll be doing that tonight. Also want to remind people that for tonight's banquet, to be sure to pick up your badge. If you haven't already, be sure you check in at the front desk so you have that. So that'll be your admission ticket for this evening. So, all right, let's get started with our next guest, our next speaker. And the topic is the occupational therapy and the treatment of ataxia, the road to independence. So please welcome to the stage Madisen Redar from Cleveland Clinic here in the Las Vegas area. Thank you so much, Madisen, for being with us. Here we go.
Thank you. All right. Hello, everyone. We got a good crowd today. Woohoo! All right, very good. Well, thank you all for having me. I really appreciate this opportunity to get a chance to talk to you a little bit about occupational therapy and how we can maximize our independence and ultimately improve our quality of life. All right, next slide, please. All right, my disclosures are as follows. All right, so let's talk a little bit about, well, what is occupational therapy? Raise of hands from the audience for folks who have had some OT in the past. Yes, all right, there we go. Good set of hands. Very good, very good. Well, if you haven't had any occupational therapy before, I'll tell you a little bit about what we do. We're really focusing on specific therapeutic techniques and occupations to support our daily engagement in our routine. So think about it this way. What do you need to do? What do you want to do? Or what are you really expected to do in your day-to-day routine to support success? Think about what brings joy to you in your day-to-day routine. As OTs, what we really do is look at an analysis. We analyze specific activities and occupations to determine, well, how can we best get this person back to doing what they love to do? We know that everybody is unique. We all have different abilities, different activities, propose different levels of challenge for each of us in our day-to-day routine. So our role as occupational therapists are to grade those activities. We might make them a little bit easier, or we might make them a little bit harder depending on the level of challenge for that particular individual. We want to think about our day-to-day routine. So this could be self-care tasks, anything from bathing and dressing, and really looking at how the environment specifically can impact those day-to-day activities. Are there supports within our environment? Maybe we have some barriers due to the location of where we live. But really the focus on is this just right challenge. So how can we improve quality of life, really promote health and well-being, and those participation in meaningful activities? Just a little background about occupational therapy. Occupational therapists will receive either a master's or a doctorate degree. They'll complete a clinical internship and then pass a national board examination, and then they may be licensed in the state that they're practicing in as well. All right, so let's talk a little bit about the occupational therapy process. So if I haven't had occupational therapy before, what does it look like when I go to see an occupational therapist? So the first thing we do is we have that referral. We have an occupational therapy evaluation. And again, that consists of developing interventions. We utilize assessments to really determine some of those meaningful occupations. In the outpatient setting, which is where I practice, usually our evaluations are about an hour, or our treatment sessions are about an hour, but they can vary from 45 minutes to an hour depending on the setting that you might be receiving care. Then what we're really doing is developing what we call a plan of care and looking at how we can challenge the frequency and the duration based on the needs of the specific client in front of us. All right, so let's dive into that occupational therapy evaluation. So as you're working with someone in the clinic, there's going to be a lot of subjective questions. My goal is to determine what is most meaningful to you. I help guide the assessment, you tell me what's important to you, and we work together to try to figure out those meaningful goals and what is really going to bring you joy. We call that the occupational profile. Then we're doing a little bit of an analysis, so I might have you demonstrate a task or bring in some equipment that you really enjoy or hobbies. I've worked with folks who, for example, love to build model cars. So by golly, we say, bring that model car in, let's take a look at it and see how we can adapt it so that you can get back into the activity and really work on those fine motor skills, because that's important to you in that respect. Of course, we look at assessments. We might have you do some measures to see how you're doing in a specific skill. But then also we're looking at, the steps needed to complete a task, how long is it going to take you to complete a task, and how can we make it easier for you in that particular case. But ultimately, we are developing our client-centered goals. We help to kind of drive the goals in the assessment, but really it's your plan of care. So now let's talk a little bit about goals, all right? It's a collaborative process. What's meaningful? We want to make it functional, okay? Can we make it achievable and achieve it in a specific time frame, okay? Maybe it's to improve our fine motor coordination because we're having trouble with handwriting or our ability to feed ourselves during mealtime. Typically, we'll do a little progress update about every 30 days. But when we see someone, we usually focus on a much higher frequency in the beginning. As we're working on those specific skills, we're developing a home exercise program so that person has all the tools they need in their toolbox to succeed. Because the goal isn't for you to depend on me. The goal is for you to take all of these tools and successes and implement them in your day-to-day routine. Of course, we do little check-ins here and there because we don't want to cut you loose forever, but we like to have those check-ins maybe in 2 months, 3 months, 6 months, so that we can make changes over time depending on how your abilities may or may not change. I will say homework is really important too. How many of you who have had occupational therapy have received homework? Raise of hands. Okay, very good. I see some homework. Very good. And think about, what did you get out of the homework? Was it an exercise? Was it a breathing technique to help with a little bit of anxiety? And really, how did it help support you in your day-to-day routine? But that compliance piece of it is very, very important for helping you to maintain that function, okay? But really, what I like to focus on is how can we empower you so that you can manage your symptoms on your own? Again, the goal isn't for you to depend on me, but for you to be able to manage your symptoms in this process of your disease, okay? And again, we might take little breaks here and there depending on insurance coverage and so forth. Okay, so let's talk a little bit about approach. So when we are looking at specific interventions to help incorporate daily occupations, we might compensate for a deficit or what we call adapting an activity. So maybe we're having trouble feeding ourselves. So instead we might build the plate up, maybe place some books under the plate so that we have a shorter distance between bringing the food to your mouth from the plate. There's also adaptations such as plate guards, and I'll have some pictures in the middle of the presentation to show you all that will help reduce food spillage as we're trying to scoop our food onto our fork or spoon in order to bring it to our mouth. The other thing to think about is how can we prevent disability, right? That's where we're incorporating those home exercise programs to prevent falls, to maximize our core strength and our trunk control, our fine motor coordination, so that we can do those activities that are most important to us. And then, of course, again, we're looking at establishing really healthy routines. How many of you, raise of hands, have a really consistent routine you follow every single day? Okay, all right. Not as many as I was thinking. I wonder why that is. Ponder that for a moment, because I will tell you that routine consistency is extremely important. I know when I get up in the morning, first thing I do is brush my teeth, right? You all have I'm sure all of you do have a routine, and you do have somewhat of a consistent routine, but think about maybe why it's not consistent. Are there barriers that might be preventing you from completing that consistent routine, okay? But again, looking at how can we manage symptoms, and then of course restore some skills in those specific circumstances. Also thinking about how the impact of these symptoms are, impacting daily occupational activities. Fatigue. How many of you have experienced fatigue? Yeah, big one, okay? So then working with your therapist maybe on pacing and energy conservation techniques. Maybe we're gonna sit and chop the vegetables versus stand. And although it might sound very simple, making very subtle adjustments to our daily routine can make all of the difference in managing those symptoms that we're all dealing with on a day-to-day basis. So I'm going to get into some general interventions. We'll try to maximize our time as much as we can. So again, as an OT, I always encourage folks, bring in your activities, bring in those fun occupations so that we can see how we can best maximize it to our abilities. We do a lot of education. So education on managing symptoms for not only our clients, but the caregivers and the families. Raise of hands on how many of you feel it's important to incorporate your spouse or your loved one in your care. Yeah, a lot of hands up. Okay, so that could be very important for some people, okay? And then really focus on different training techniques, okay? So I'm gonna have you participate in the task. We're gonna go through a showering simulation, okay? So really that task-specific training, that's really important. I always encourage folks to bring in pictures or videos of their home so that we can look at home safety and the environment to maybe make any recommendations, depending on if you have a therapist you're going to see out in the community versus someone who is coming into your home to help you in that particular perspective. And we might go through some checklists to determine, well, maybe these stairs could be a barrier. Maybe we could incorporate a ramp or some grab bars in the bathroom so that we have a reduced risk for falls, okay? And then really looking at different adaptive equipment or technology, and we'll get into some of that in momentarily. So let's talk a little bit about home safety modification. So really, what are the benefits, right? We want to prevent falls, okay? Raise of hands, fear of falling. Okay, I see those hands going up. So we need to think about the why. Why are we so afraid of falling, and how can we improve that confidence level? That is really what the key is. How can we improve our confidence so that you feel good walking in your home or mobilizing through your home, completing your day-to-day activities, okay? And really making sure that that independence level is right where we need it to be. The other important thing to consider is what are our risk factors, okay? So we might look at our fall history. Where were the falls occurring? How often were they occurring? Was it after breakfast? Are we managing our medication? And as an occupational therapist, although we might think it's just those self-care tasks, your basic activities of daily living, it goes much more beyond that. Anything from leisure participation, what we call instrumental activities of daily living, where we're really looking maybe at medication management, pet care, communication with the healthcare system, managing one's home. All of those things are occupations, and they're important to a lot of people. So how can we address that? And then, of course, working with our physical therapy and speech therapy colleagues to look at how we're able to safely use a mobility aid or device to get folks to where they need to go. All right, so thinking about home safety. So if we're going through an assessment, we're incorporating grab bars, right? In the bathroom, in the shower, in the hallway. Maybe we might start to use adaptive equipment. So I could use a shower chair or a bath bench so that we're able to sit versus stand to reduce the risk of falls when we're doing those daily self-care activities, but also to conserve a little bit of energy depending on your specific symptoms. Now, we don't always think about vision, but I think it's very important that we talk about it for a second, specifically if we're dealing with spinocerebellar ataxia type 7, because we know that there are some changes with the macula of the eye, so we might need to incorporate some lighting adjustments. So if we think about the macula, that's our central vision, our color vision, that fine detail. So incorporating lighting adjustments, enhancements, so that we can do some of those fine detailed activities. Of course, removing some clutter. As OTs, we do not like throw rugs. You'll probably hear every OT say, let's remove the throw rugs in the home, if they could be a bit of a little clutter disaster, but really focusing on home organization to the best of our ability so that we can maximize that mobility space, and thinking about maybe using contrasting colors, magnification needs, night lights at night that are automatic with motion to really help focus on giving us the best quality of life that we can. All right, so let's talk a little bit about our daily occupations. So I talked a little bit about this earlier, but I think it's really important to understand what really is in the scope of occupational therapy, because we do many different things within our scope. So we already talked about the self-care tasks. And I think what's important, especially when you're speaking with your provider, is how are your symptoms impacting your day-to-day routine? We know it's important to have those referrals for physical therapy, speech therapy, but we often neglect the daily self-care tasks. So our grooming, our dressing, we're looking at financial management, driving. When do we need to have a conversation about driving safety? And how are we going to, create a community mobility plan so that we can get you to where you need to go? And again, health management is another scope in our area of practice. So we might be focusing on a physical activity routine, being a little bit more consistent with those physical therapy exercises, and trying to find the best time of day when you have the most energy or you're feeling your best to incorporate some of those higher intensity exercise. And then, of course, looking at sleep. So how many of you have a really good sleep hygiene routine before you go to bed? Uh-oh, a couple, okay. So we need to think too, are there any interferences that prevent us from having a good night's sleep? Are we watching TV all the way up until we go to bed? Are we on our phones having a little bit of that blue light before bed? Are we drinking a lot of liquids in the evening? And then as a result, we're having to use the restroom multiple times during the night, which then also puts us at a fall risk, right, when we need to get to the bathroom. So really looking at routines in detail is a very important aspect of occupational therapy. And then, of course, leisure. How many of us, raise of hands, have a pastime or recreational activity that they love to do that they're struggling with right now? Okay, raise of hands. So we need to think about what brings you joy. And so how can we adapt or compensate for some of the changes that we're experiencing so you can continue to do that? Because of all those other things are important, we also have to think about what brings us happiness. And that's a very important piece to the puzzle in our day-to-day occupation. And then are we able to participate in community events, going maybe to our local gym or bingo night or whatever it might be that's important to you. All right, so now, when we think about occupational therapy, as you're working with your therapist, you might think, well, what are some of the strategies that my therapist is going to use? So we talked very generally a couple slides back, but if we think about compensation, right, we're compensating for a loss of skill or function, okay? So thinking about kind of that spinocerebellar ataxia type 3, where we know that fatigue is a pretty significant symptom. How are we going to incorporate energy conservation techniques, pacing techniques where we're taking rest breaks throughout the day, or we're modifying a task so that we're utilizing less energy, okay? The other thing to think about too is this proximal stabilization. So proximal stability to promote distal mobility, really controlling the joints and the trunk control as well. Then of course we might incorporate different adaptive equipment. We might use a two-handled cup to drink. We might have an elastic or a magnetic shoelace, or we might even build up a handle if we have a little bit of hand weakness. Weight we may use in specific circumstances as well. If we think about some of the literature, there was an article that was produced by Yang in 2020 and looked at the prevalence of non-motor symptoms. When we think of ataxia, we always think of the motor symptoms, but that's not always the case. The non-motor symptoms, it was between 52 and 63.5%. Wow. So how are we going to address those other symptoms? And some of those common symptoms, not just fatigue, but anxiety and depression. Very important piece, and how that could impact your day-to-day routine. If I'm not feeling up to it and I'm feeling really down or anxious, that will probably prevent me from doing an activity that I really love to do. So how are we going to work with our behavioral health team, our occupational therapy team, so that we can manage those symptoms more appropriately? Okay. Cooling strategies. So this is an interesting topic. There's been some literature on very temporary effects. So what the literature has shown us is reducing tremor with, say, an ice pack wrapped in a towel in the affected area for about 10 to 15 minutes before an activity, let's say handwriting. Okay, and I'll show you some examples in a bit. But what we found in the literature is this specific modality decreased the frequency of the tremor, right? So the number of cycles in a minute, okay, and also the amplitude of the tremor, so that distance traveled in the specific tremor itself, okay? So thinking about how can we facilitate that body space and really think outside the box in managing our symptoms. But again, always want to make sure that you have that conversation with your rehabilitation specialist, because of course these are general strategies and there is not a one-size-fits-all. All right, so then we think about that bigger picture, activity modification. So maybe I'm doing a particular task and I'm going to modify the task. I'm going to reduce the number of steps involved in the task. Maybe I'll use my non-effective side, or I'll sit versus stand, okay? I might eliminate part of the task altogether and have my care partner or my spouse do a part of the task for me, so that we're still engaged, but we're making changes within the task. All right, to wait or not to wait? That is always the question I receive. So there is some mixed literature on the use of weighted adaptive equipment to try to minimize the impact of tremor and ataxia on our day-to-day occupations. These are just some examples of a weighted sleeve and a weighted glove that may go on the back of the hand if it's more of an upper extremity ataxia and tremor. There's also been literature with the use of wrist weights as well, but again, the literature is mixed. There might be some benefit. Others, it might make it worse. So really what I always encourage my clients is let's try it. And if we like it and it gives us a little bit of benefit, great. If it doesn't, then we need to find some alternatives to help us with that day-to-day activity. But I tell people, try it first before you buy it when it comes to adaptive equipment, and try to actually participate in the task itself to see if it's going to help to improve coordination, reduce the frequency and that amplitude of tremor, and the intensity as well. Now, I'm going to go back for just a second, going back to the weighted equipment. Really quick, when we think about the weight, so usually what the literature has shown about 1.3 to 1.85 pounds, but I've seen some gloves that were about a half a pound to a pound. So again, it depends on the individual, their body weight, and the specific activity. All right, how many of you have seen some of this, these built-up handles? All right, I see some hands in the crowd, very good. So this is just built-up foam tubing. So if we are having some troubles with our hand strength, with our grip strength, really what we're doing is just compensating for that, incorporating a much larger surface area to grip. So we might put this on a toothbrush, we might place it around a pen or a razor if we're shaving, just to have a little bit more grip to support our task participation. All right, some writing aids. How many of you find that writing is challenging? Raise of hands. Oh, wow. Okay, so quite a few of you. All right, so again, this is a trial and error. We have to figure out what's going to work best for you. Is it that we really have to focus on our core muscles and we need to develop a strong home exercise program, really look at good body mechanics? Do we have our feet on the floor? Are we supported in the chair? Do we have a little bit of lumbar support? And then we can start playing with some of the fun equipment. So as you see that blue pen, that's an ergonomic pen, so it is not weighted, but you would place your index finger in the pen, and it can be very great with arthritis too. Then we might trial some built-up pens or even some weighted pens. The top pen on the right, that is a weighted utensil holder, so we can use that for not only just pens, but other, I used it for makeup, razors, things of that nature. But then really too, we look at the task itself. Maybe we need to utilize lined paper. Maybe we're going to focus on slower, high amplitude movements. Maybe we use a little auditory stimulation with a metronome or some light music in the background. But again, everyone is different, and we need to think about the particular individual. But there are adaptations out there, so it's really about trying it and practicing to see what is going to work best for you. All right, dressing, always a popular topic. If we think about shoes, okay, we know those shoelaces and the fine motor dexterity can be challenging at times. So maybe we adapt the task and we do an elastic shoelace, or we do a magnetic shoelace, or we might have a shoe where it's a zip on top where we can slip the foot right in, zip it up, and we're good to go. On the right, we have a built-up button hook if we're having some trouble with buttons, or we might have a weighted button hook depending on the individual itself. All right. Let's get into some self-feeding for a second, all right? So a lot of different tools on the market to support your participation. So we might have a weighted cup. You can see on the left we have two handles. So we have a little bit more proximal stability. Or if I'm holding a cup or I'm holding a coffee mug, I might do a little proximal stability, keeping my arms close into the trunk in order to bring the cup to my mouth when I'm drinking to support that stability. Again, we can try lots of different adaptive utensils. We have built-up spoons and forks, rocker knives, weighted equipment, even plate guards as well, so that we're preventing the food spillage as we're scooping from the plate to our mouth. Again, I always like to try to build things up and really look just at the environmental setup, because there may be something within the environment. Our chair's too low, our chair's too high, the table's too high, and we're just not comfortable in that particular fit. So I think, it's really focusing on a very practical but functional standpoint when we're doing our own analysis. And I really encourage you to advocate for yourself. Chat with your referring provider if you're feeling like, well, I could probably use some of these tools. This might be really helpful. I'm going to chat with my doctor or my referring provider, maybe my physical therapist, and see how I can best support myself in my day-to-day routine. All right, as we get into more activities of daily living, like showering and toilet safety, so what we have on the left, that is a drop arm bedside commode. So if we think about fall prevention in the evening, if we have to rush to the bathroom or the bathroom is much farther from where our bedroom is, it might be easier to transfer from the bed up into the drop arm commode so that we can have a really easy bathroom experience to prevent those falls at nighttime. You can see in the middle we have a raised toilet seat that can clip onto the toilet, making the toilet a little bit higher. We have the armrests at the side so that we can push up nice and safe and have a really good trunk control. They have raised toilet seats with handles. They also think about handheld showers when we're taking a shower, and then we have a bath bench. So half of that bath bench on the right goes in the tub and half of it goes out so that we can sit on the edge, slide ourselves over, and take a nice leisurely shower as well. But again, think about too the positioning of your shower supplies. If you are sitting, are they within an easy reach for you so that you can reach your shampoo and conditioner? Maybe we think about soap on a rope. if we do drop our soap or our body wash, or even placing a soap in a nylon stocking, and maybe we tie it to a grab bar in the shower so that we have easy access, as well as a wash mitt to make sure that we're washing our body appropriately. And then if we think about drying ourselves after the shower, which can be a little bit fatiguing, maybe we consider a terry cloth bathrobe so that we don't have to waste so much energy before going into the next task. All right, so let's transition into healthy routines. So let's think about our neuroprotective benefits. So how many of you have heard of the pillars of brain health? Raise of hands. Pillars of brain health. Yes, okay, I see some hands in the audience, fantastic. So if we think about our pillars of brain health, what can we do to support those neuroprotective benefits? So again, if we think about the definition, it's the mechanism and strategies that are used to defend our central nervous system from injury, all right, to prevent damage. So when we think about a really healthy day-to-day routine, we're incorporating our physical fitness, our exercise. We'll get into a little bit of that in a minute, and then we'll have some exercise followed up by Kayla, who is our physical therapist. Also incorporating mental fitness, cognitive stimulating exercise. Raise of hands, who's working on some mental fitness? Do we have some good cognitive apps, activities out there? Couple hands, all right. And I always tell folks to find something you enjoy. If you are not a crossword puzzle, we're not working on crosswords. Let's find something else that you enjoy that can help to stimulate the brain and keep you active. Then, of course, we think about a good food and nutrition routine. We're controlling our medical risk factors, having our regular medical visits, having a good night's sleep, incorporating relaxation, and then that social engagement piece. We want to make sure that we're socializing and not self-isolating from the things that we really love to do. And again, also thinking about how neuroprotection increases our blood flow, it increases our brain volume by incorporating all of these really healthy activities. So as an OT, when I look at someone's day-to-day routine, my goal is to help promote health and well-being, okay? There's this term and this approach out there called lifestyle redesign, right? Where we're really looking at the relationship between our day-to-day activities that really help guide people across the occupational therapy process. So we're looking at our habits, our routines. All of you have roles that you do on a day-to-day basis. You're a mother, you're a father, you have children, right? And so we're looking and reflecting on those day-to-day activities. You know, what went well? What didn't go so well, and what could I work on next time to make a change to that, okay? And again, I always bring it back to what brings you joy, that intrinsic motivation. How many of you, raise of hands, have one thing in your life that brings you an amazing amount of joy? I should see every hand in that audience. We'll find it if we don't today, okay? But think about that for a moment, okay? And really think about, well, how are my symptoms and the environment impacting my ability to really feel that joy? So we need to address that, okay? And thinking about planning activities. If you're not getting out and about, maybe we're gonna work with our therapist and plan an activity that's most important for us. Every Friday, we are gonna go to paint class, and we have some of the tools and modifications to participate in that task. I'm a painter, so I really enjoy that, as well as gardening. All right, exercise. All right, how many of us are exercising in the room? Yes, okay, very good, very good. So exercise. So let's talk a little bit about just general guidelines. Again, you always want to talk with your referring provider or your therapist before starting a home exercise program. We know it's important, but we want to make sure it's tailored to our specific needs. Now, if we look at general guidelines for Americans, about 150 minutes per work of a moderate intensity or 75 per minute of a vigorous intensity aerobic routine. Our walking, our biking, our swimming, and then incorporating at least 2 days per week of strength training. We're focusing on all the major muscle groups, as well as, maybe 1 to 2 sets, 10 to 15 repetitions, but also incorporating our balance and our trunk control. Very important activities to support success. So what's the goal? Why am I doing these exercises? I don't like to exercise. Well, if we think about it this way, we want to prevent falls. We're trying to improve our safety and ultimately to be able to participate in those things that we really love to do. So I might do a static balance exercise where maybe I'm standing on one foot, or maybe I'm doing a functional reaching task into a specific cabinet or in my bedroom to simulate that dynamic balance activity as well. Thinking about maybe I'm doing a seated march, okay, versus a standing march, or might have upper extremity support where I'm holding on, or maybe I've graded it up where I don't need that right now, okay? So we might use specific equipment like a physio ball that we might sit on, those big old balls, foam padding, or what we call those balance discs. But we've seen in the literature, though, is really focusing on a higher frequency and duration. So a higher reps, so maybe we're doing an exercise for 2 to 5 minutes at a higher duration during the week. Once a week is probably not going to cut it, okay? So then we need to think about how we can best incorporate that into our routine. All right, posture and coordination. So we're incorporating exercises that focus on the trunk and the neck to help improve our postural stability, which ultimately will improve fine motor, or that distal stability, okay? So I might focus on exercises of the scapula, scapular retraction, okay, of my shoulder blades, core stability, and again, ultimately what we're doing is trying to maximize our ability to use our arms, improve our tremor, our balance, and the control of our trunk, okay? And those exercises might be where we are in a quadruped position on the floor. We might be in a supine position lying down on our back to do an exercise, or again, we might be sitting or standing. And then we think about coordination training. So it's great to work on gait, but then how are we going to focus on maybe the upper extremities in this case? I always tell folks, make it functional, make it fun. Really looking at slow and controlled movements. Again, we're focusing on a higher repetition. We might focus on a target training. So maybe I'm holding a pen and I'm having you reach to touch the tip of the pen or click the pen, right? So we're focusing on that distal mobility. We might also work on building. How many of us have played Jenga? Raise of hands. Oh, I know all you play Jenga. Okay, but we're focusing on building, right? Building, use of everyday objects, focusing on our core, focus on reach. Make it fun. It doesn't have to be, basic, boring exercises, okay? And then we might focus on some eye-hand coordination. I've worked with folks where maybe I'm holding a ball and I'm gonna have them catch the ball to work a little bit on eye-hand coordination. And then thinking about those rapid alternating in movements, right? That supination, pronation, flexion, extension, right? Really, really focus on rapid alternating movements to support our ability to complete a task. All right, now other symptom management. So again, we talked a little bit about this earlier, but thinking about energy. Okay, so pacing techniques. How can we prioritize our activities in our day-to-day routine? What's really most important to us that we really want to accomplish? Maybe there's a specific activity that I could wait till Wednesday to do in order to accomplish the activities that I have on my plate right now. Another thing to think about too that we don't maybe always address in occupational therapy or physical therapy is our bowel and bladder habits, okay? So maybe we take a look at our fluid intake. Maybe we're not getting enough fluid in, or maybe it's too much and we're having those frequent bathroom trips. Looking at bladder irritants. So are there specific foods or drinks that we're consuming that are actually irritating the bladder and causing us to use the bathroom more frequently? And also thinking about maybe a toileting schedule. Maybe we need to void every 2 hours and have that set in the schedule as best as we can to help support and prevent incontinence, okay? Compression stockings, how can we best put those things, take them on and off? We know that those are not fun, but they do have different adaptations to help support our ability to do those. The other thing to think about is maybe we're reducing some environmental distractions and we're really focusing again on self-reflection, incorporating dual tasking, a mental task and a physical task at the same time, okay? And also the other thing to think about is self-regulation. I'm sure the behavioral health team prior to my talk maybe talked a little bit about how we manage anxiety and depression, incorporating mindfulness. How many of you have incorporated deep breathing or mindfulness into your routine? Raise of hands. Okay, I have a couple here and there, very good. But really that could be yoga, that could be focused on deep belly breathing. It could just be a leisurely walk that we're having and focusing on all the senses of the environment around us to support our day-to-day routine. So then we need to think, well, is OT right for me? Okay, so I always tell my folks, and maybe you're working with another clinician in a different discipline, but thinking about your symptoms, okay, and really considering, well, are my symptoms limiting my ability to do the things that I need to do or want to do? And that could be any occupation that we have besides ambulation and walking, okay? Chopping vegetables, making meals for our family, cleaning our home, all of those things are within the scope of an OT's practice to address. Okay, so again, looking at our day-to-day routine, struggling with daily performance, and then think about too, if you are looking for a provider in your community, as I know we have many folks from all over who are visiting us today, is trying to find someone with some neurological experience. There are many different OTs out there, a lot who may focus on orthopedic conditions, and it's a very different approach to care. And I always say too, if maybe you're visiting a clinic who focuses on neurological conditions and you can get that card of that OT who has that experience and give that contact information to another therapist closer in your community so that you can have that person chat and bounce ideas off. I do it all the time. You know, tell that person to call me. I'd be happy to collaborate and talk about some different adaptations or strategies to really support you in the day-to-day environment. So really thinking about what's going to make you happy and keep you living your life to the fullest, which is really what we do. So thank you all very much. I appreciate it. My references are here, and we should have our physical therapist coming up next. Thank you all so much. I really appreciate it.